In today's webinar, I will talk about the issue of dental fear and anxiety, as well as the impact this condition can have on your residents' overall health and well-being. I will discuss the benefits of helping your residents overcome this fear and anxiety. I will also discuss various ways that you can help your residents cope with dental fear and how routine in-house dental care visits can be very beneficial to those who have dental fear and anxiety. Fear and anxiety associated with going to the dentist is very real for a number of people. This fear is a condition called odontophobia. Odonto is defined as tooth or teeth. Phobia comes from the Greek word phobos, meaning an irrational fear or horror. Odontophobia is the condition of having an irrational, overwhelming fear of dentistry. Dental fear and anxiety can cause many issues for a resident. Residents can be so anxious they have trouble sleeping the night before a dental visit. They may become physically ill at the thought of a dental visit. Their blood pressure can rise, and they may get a headache or a stomach ache. Residents with dental fear can become emotionally distraught as well. They may cry at the thought or mention of a dental appointment. They may have intense uneasiness at the thought of dental treatment. A common reason for dental fear is having had a traumatic experience at a dental visit in the past. They can also have fear of pain or injury, and they can have fear of the unknown or not knowing what to expect at the dental appointment. A resident can have lack of trust toward the dentist, can have a fear of choking or gagging during a dental appointment, or a sense of helplessness or lack of control during treatment. This fear can lead to a resident being uncooperative during dental treatment, or in severe cases, complete avoidance of dental appointments. When a resident's fear causes dental avoidance, this can lead to extreme oral health complications, which in turn can affect a resident's overall health and well-being. Poor oral health can lead to oral health issues like gum disease and cavities, as well as systemic health issues like diabetes, heart disease, cancers, and Alzheimer's. Mouth pain or discomfort can affect a resident's ability to chew their food, which can lead to nutrition issues. Poor oral health can affect a resident's emotional health and well-being. Dental issues can cause embarrassment for the resident, which can lead to social isolation and loneliness. Residents may avoid social activities, refuse to go to the dining room to eat, or shy away from company. Helping a resident overcome their fear of seeing the dentist can have a profound effect on your resident's quality of life. Let's talk about some things you can do to help alleviate a resident's fear of seeing the dentist. It's important to discuss an upcoming dental appointment with a resident ahead of time. Don't wait until the day of the appointment to tell them they're going to see the dentist. Letting the resident know a few days in advance of their appointment will give the resident time to discuss their concerns. It will also give them time to get help dealing with their concerns. When you let the resident know about the appointment, it's important to discuss what will be done at this appointment as well. Try to find out from the dental team as much information about the appointment so you can relay this information to the resident. Helping a resident understand what will be done at the dental appointment will help ease their fear of the unknown. Ask the resident if they have any questions or concerns about the appointment. If the resident expresses fear about the dental appointment, ask them what they're afraid of. Talking through these fears can often help to alleviate them. If a resident has a dental fear based on a past experience, they will often have anxiety about seeing a dentist again, thinking that they will experience the same trauma as they did in the past. Finding out exactly what the resident is afraid of can help you better discuss an upcoming appointment. It is important to let the dental team know of the resident's fear as well. Keeping the dental team informed of a resident's fears will help the dental team prepare for the resident's appointment. It can also be very helpful to have the resident meet the dental team before an appointment is scheduled if possible. On the day of the dental appointment, make sure you give the resident enough time to get ready. Avoid rushing the resident, as this will only increase the resident's anxiety. Make sure they wear comfortable clothes, that they're not too hot or too cold. Make sure they have eaten, and ask if they need to use the restroom before leaving the appointment. Offer to let them bring a book with them to read or headphones with music to listen to. If they have a favorite stuffed animal or doll, let them bring this to the appointment as well. Helping a resident to physically relax in addition to mentally can also help. Teaching a resident proper breathing techniques can encourage physical relaxation. Diaphragmatic breathing, for example, uses the diaphragm to reduce tension in the chest and provides more oxygen for the body per breath. So let's learn how to take a deep, calming breath. Take a long, slow breath. Breathe in through your nose, first filling your lower lungs or stomach, then your upper lungs. Hold your breath to the count of 3, and then exhale slowly through pursed lips while relaxing the muscles in your face, jaw, shoulders, and stomach. So you're going to take a long, deep breath through your nose. Hold it to the count of 3, and then exhale through your mouth while you relax your face, your jaw, your shoulders, and stomach. One way to teach deep breathing to your residents is to tell them, smell the flower, blow the pinwheel. This technique will help the resident understand to take a deep breath through their nose as they would to smell a flower, and when they release that breath, tell them to blow as if they're blowing on a pinwheel, which will help them purse their lips. Guided imagery is another way to help residents relax. Teach the resident to develop a mental image of a pleasant, tranquil experience, making sure to add specific details like sound, smell, and colors. This will help them to focus on a pleasant experience instead of their fear, helping to reduce anxiety and achieve relaxation. You may encounter a resident who's anxious or fearful when you're trying to help them with their oral care. Talking with the resident about the importance of good oral care can be very helpful in easing their fears. Make sure you are at eye level with a resident when you speak to them. Standing over them can come across as dominance, which can increase the resident's anxiety. Talk softly and be kind. Never scold or lecture. Giving the resident some control over their oral care routine can be beneficial as well. Letting the resident decide what time is best for you to come help them with oral care can improve compliance. Some residents may do better early in the morning, while others may do better later in the day. Some may be less compliant when they're tired or if they're hungry. Some are less anxious with certain caregivers than others. When you're performing oral care on a resident, it is important to first tell them what you're going to do, explaining it step by step. Then show them what you're going to do. Let them see and touch the oral care tools you're about to use. Only after you tell them what you're doing and show them what you're going to do you begin to do the oral care. So it's a tell, show, do method. While you're performing oral care, do not deviate from the steps you explained to the resident. By doing exactly what you told the resident you would do builds trust, which will help to make the next oral care session much easier for you and the resident. Verbally check on the resident also while you're performing care to make sure they're doing okay. This will build trust and acceptance. It can also help to ease the resident's anxiety. Gentle communication, along with consideration of the resident's needs and feelings, is crucial for compliance. Having a dental team come to the nursing care facility can be very beneficial for residents, both physically and mentally. The stress of leaving the comfort of their own home can be very overwhelming for residents. Dental treatment performed in an environment they are already comfortable in can significantly ease fear and anxiety for residents. In-house dental care also limits the resident's exposure to persons outside of the nursing facility, which can help protect them from contagious illnesses such as colds and flu. It is important to note, in cases of severe anxiety, if a resident cannot calm down or is expected to be uncooperative during the dental appointment, an anti-anxiety medication given a half an hour to 1 hour prior to appointment time may be needed. Please consult the resident's physician about this option if it's necessary. On behalf of the entire Senior Dental Care team, I want to thank you for joining me today.